Hi, I'm Selena Campbell, a frequent host of the podcast This is Infertility for Progeny, a leading fertility benefits management company. Egg freezing has been around for a while now, and we've posted a few videos on this channel about egg freezing and the process, how it works, and who's a good candidate. But today, we want to go a bit deeper into this concept, and we're going to do it with the help of an expert, Dr. Julie Lamb, a reproductive endocrinologist from Pacific Northwest Fertility. Before we dive in, I just ask that you please subscribe and like this video, because doing that helps others to find it. I want to talk about the concept of elective medicine versus preventative medicine. Traditionally, when people and the media discussed egg freezing, they would tend to speak about it in terms of being elective medicine, an elective procedure that some women choose to do. In fact, we've heard it called elective egg freezing. But if infertility is a disease, egg freezing allows for many to overcome that disease when they're ready to have a baby, then is it truly elective? Or does it then become preventative medicine? We asked Dr. Lamb about her thoughts on that. Is egg freezing truly an elective procedure?
Elective egg freezing became non-experimental in 2012. We've been freezing eggs for cancer patients for a really long time. So for the first time, people can come and talk to me and freeze their eggs for other reasons. So I think that's the big, huge misconception is a lot of people think, okay, well, it's elective, but there's a lot of other indications for egg freezing. You know, quite a few women have endometriosis, which significantly impacts fertility later in life, so we see a lot more infertility in that patient population that chooses to delay pregnancy even by a few years. Someone in their early 30s shouldn't have a difficulty getting pregnant, but people with endometriosis do. So I think having that conversation in your well woman visit with your primary care or your OBGYN provider is a really important piece of this, not only to learn about your fertility, but learning about what other conditions you have that could impact your fertility so that you can make really educated decisions for yourself about egg freezing.
Dr. Lamb mentioned endometriosis as an indicator that some might want to consider freezing their eggs. We asked her if there are other conditions or indicators that people should keep in mind.
So there's a lot of other reasons to freeze your eggs that aren't necessarily elective. And some of those are endometriosis, being a BRCA1 or 2 carrier, having a family history of premature ovarian failure or early menopause, having a family history of difficulty conceiving, or having just even a low AMH, knowing early on that your fertility window could be shorter than you want it to be, is not really elective at that point. So getting the information so that you can make a really informed decision for yourself is important.
That's the thing. There are many women who would benefit from egg freezing, but nobody is saying that every woman should go out and freeze their eggs. Like all things with our health, it's personalized. But without going and getting the information you need, it would be impossible to make a decision that works best for you.
It takes years for somebody to come and see me to get up the courage, or they'll be like, I've been thinking about coming to see you for 5 years. So if they can either talk to their provider or talk to their OBGYN at their well women visit when they're there talking about contraception, about what their fertility plan is, and just knowing that it changes with age and knowing where they are in that fertility window, they can make better choices for themselves. Even if that's starting their family sooner or deciding they're going to build their family in other ways. It doesn't have to be egg freezing or embryo freezing.
Another important thing to understand is that egg freezing is not only for those who are not ready to have a baby yet. Egg freezing and embryo freezing is an important part of the family building conversation for those who are utilizing IVF to grow their family.
Right. I think one of our faults as doctors is not taking that step back and saying, okay, well, what is your family building goal? I know you've been trying for a year. I know you just want one healthy baby at a time, but ideally, do you want 2 someday? And that not very many people want only 1. And so just making sure you know what their goals are before you start the process and kind of setting expectations from the beginning about what you're looking for and what the process is like and how long it might take to achieve that. So I see every day patients that are starting to build their family at advancing ages, so in their late 30s or early 40s, whose overall family building goal is more than one child. So if your goal is 2 or 3 kids and you're starting at 39, it doesn't get easier to achieve pregnancy as you get older. So having that conversation about how IVF and assisted reproductive technology can help them save something and become fertility preservation at the same time as you're doing kind of that fertility treatment with the IVF is one of my passions.
The key about egg freezing is simply understanding what it is and why it can be useful. The myth that IVF can fix everything down the line is a bit of a dangerous one, and egg freezing can truly prove invaluable in many situations.
In one generation, we really went from having babies in our 20s to having babies in our 30s and late 30s even, or early 40s. But the information gap hasn't caught up with that. Patients, even my physician patients, don't understand how fertility decreases with age. You know, the common misconception is that IVF can fix it. IVF can overcome age, and you know, if they can't get pregnant at 40, they'll just come see me and do IVF. But it's certainly not the fix-it that we want it to be.
The purpose of this video isn't to tell you to go and freeze your eggs, and it's certainly not to scare you into thinking that time is running out. The purpose of this conversation is to do one thing: let you know that this technology does exist. And with that, we hope that you can go get all the information you need to see if egg freezing is a good fit for you.
The technology does exist, so knowing what your options are before it's not too late is much better than seeing the patient at 44 that's been trying for 5 years and doesn't understand why she's not getting pregnant. And you know, at that point, her best option is donor egg. So you know, if you're able to freeze your eggs in your 30s, you're essentially serving as your own donor if you need that in the future.
If you want to learn more about egg freezing, we have some more videos on this channel, and you can find articles and other materials at progeny.com/education. And if you want to hear some more stories from others who've frozen their eggs, you can find those on our podcast, This is Infertility. And of course, don't forget to like this video if you found it helpful, and to subscribe to this channel, because it really helps others to find this information.